Hey guys, my name's Ashley. I'm a pharmacist and work at Poison Control. And just an upfront disclosure that this video does not represent the views of the Minnesota Poison Control System or any other poison control or the hospital system in which we are based out of. This video is not to encourage or necessarily discourage certain activity, but instead meant to be a guide for people that may find themselves exposed to certain crowd control agents during this time. So first and foremost, if you have asthma or any underlying respiratory illness or disease, it's really important that you carry your inhaler with you because a lot of the crowd control agents are lung irritants, and immediate exposure is going to cause a lot of coughing, irritation to the throat and lungs, and can potentially cause an asthma attack. If you happen to be exposed to a gas or smoke, the first thing to do is to move to fresh air as quickly as possible and remain there, especially if you're having symptoms until your symptoms improve. And then you can wear a mask and wear goggles, but ultimately a self-contained breathing apparatus or SCBA like fire departments and paramedics have, it's probably not going to do a whole lot for you. And it's really important that if you have any like chest tightness, chest pain that goes unresolved, especially after a few hours of being in fresh air, that you need to seek medical treatment right away. There have been some concerns that these agents could be carcinogenic or potentially cancer causing, and the more likely situation for that is if you are in like an occupational or workplace setting and exposed to these certain chemicals over long periods of time versus a one-time exposure here and there intermittently. You might come across pepper spray or bear spray or mace. They're all basically the same and have capsaicin, which is what makes a chili pepper hot. This product is going to cause a ton of irritation, discomfort, pain, tearing. Your nose is going to run, things like that right away. So if it were me in these situations, I would be carrying several bottles of water and maybe even those like travel bottles of contact solution with saline, not the hydrogen peroxide ones, but just plain saline, so that if you were exposed in your eyes, you could quickly take out your contacts if you have them and then irrigate them with copious amounts of the saline or the water. Same thing if you were to get it on your skin or your mouth. If it's on your skin, you should use a little bit of just mild soap and water. If it were in your mouth, just drink water, whatever's comfortable. Don't use milk, don't use any other things to try and neutralize it. It's just water. I would also consider picking up one of those like handheld fans that people use on hot days because they found that cool blowing air with capsaicin or pepper spray type exposures is actually really helpful to relieving symptoms in addition to the irrigation. Ultimately, just know that we are here to help at Poison Control, no matter who you are, where you come from. And if you need help with guidance on managing these types of patients in maybe your emergency setting or workplace or an individual with an exposure, please call us. We're happy to help as much as we can. We have so many experts and so many groups and resources that we work with in these situations that we are definitely an underutilized resource and we want to help. So call us 800-222-1222. It's free, it's confidential, and we are there all the time. Stay safe and let's take care of each other.